Doctors of Reddit, what home remedy has a patient try that backfired in the worst way possible? Found a cavity in a little girl's tooth, and rather than have it filled, mom tried to heal her kid's cavity with oil pulling. Kid came back for her 6-month checkup and mom expected me to see the cavity was healed because it had stopped hurting. She told the hygienist not to tell me because she wanted me to be surprised when I saw it. The cavity had grown so large the tooth needed to be pulled. Massive giant hole in it with tons of decay. You don't have to be a dentist to understand you were looking at a massive cavity. It had stopped hurting because the nerve had eventually died and was causing an asymptomatic infection. Poor kid. Not a doctor, but an underground mine engineer. I learned through college and from older friends' family in my hometown in northern Ontario that miners would inhale McIntyre dust or aluminum dust before and after every shift to protect their lungs from silicosis. This was a thing for years between 1920 to 1960 or so, especially common in uranium and hard rock mines. It was later proven that it had no benefit against silicosis and has been linked to increased risk of Parkinson's disease, not to mention years of lung disease illness. To make things worse, it was backed by the mining companies and Canadian government for many years. I heard about this on a podcast recently. In the US, mining companies sprayed aluminum dust on miners before starting their shift. Pediatrician here. You wouldn't believe how many parents and grandparents think it's a good idea to treat the burn wound of their child with toothpaste or flour, or even worse, a mixture of both. Getting the stuff off while cleaning the wound is a nightmare. Don't ever put random stuff on open wounds if you don't exactly know what you're doing. We had a patient in the ICU who came in with swelling and necrosis to one of her breasts. She ended up leaving AMA but came back the next day because it was worse. In the interim, she and her friend sprayed WD-40 on it assuming that would help. It was an infection from injecting M. She lost the breast. My husband had a guy who came in with vague neurological symptoms. Turns out he was ingesting borax to increase his boron levels. ETA. Husband said the guy thought it would help his arthritis. What a boron. Tooth whitening with bleach baking soda mix. Repeatedly. Teeth were white and chalky, and you could crumble them with fingers. This is really horrifying for some reason, like a nightmare. PT stepped on a nail, and instead of just pulling it out, he decided that he should just put his foot in milk. 4 reasons. Pro tip: don't do that unless you want a serious infection. Bonus: different PT with another puncture wound in their foot decided to put their foot in Listerine. At least he didn't have to worry much about an infection from doing so, but that had to hurt. One of my kids stepped on a nail while wearing foam flip-flops. Apparently the flip-flops make the whole thing worse because they are covered in bacteria, and when the nail went through it pushed that bacteria into his foot. Ended up on antibiotics for 2 weeks. He had his siblings pushing him around in a wheelbarrow so he wouldn't have to walk. LOL. Relatively minor thing I did once but got a lecture from the doc about. I was camping and a bug flew in my ear and died. I thought I got it out with the arm of my sunglasses. I honestly completely forgot about it until like a week later when my ear was totally infected and swollen. The doc was like, next time just come see us. Saw a patient with prostate cancer that by the book should have been curable with surgery. He ran off to see a herbalist who had him take DHEA. His wife managed to bring him back about a year later and he wanted surgery. I rechecked his R first before agreeing and it had skyrocketed. Bone scan showed the fuse mets, so no point in surgery anymore. I had a patient put dry ice on his leg because it was hurting. It was hurting due to lack of blood flow and basically he performed a medical amputation with the ice. Another one that I vividly remember from my intern year had a boil on the back of his neck. Infected hair follicle or something. Instead of seeing an MD and taking antibiotics, he concocted an ointment that he then continued to put on that area for a prolonged time. It got so bad he basically had a horseshoe abscess starting on the back of his neck and going down both sides of his neck. We drained as much as we could in the OR and did whatever we could at dressing changes, but it was understandably painful. Somehow that was my fault personally. He told me I need to educate myself on how to treat him better. That was in the beginning of me being a doctor in US and I didn't know the fake politeness yet, so I told him if he came to the doctor instead of mauling himself we wouldn't be in this position. We had an elderly patient trying the Epley maneuver at home to relieve her BPPV, vertigo caused by crystals in the inner ear. The maneuver includes sitting on a bed and throwing yourself back onto your pillow. Harmless, unless you hit the wall behind you. She suffered a subdural hematoma and had to get her skull drilled and sawed open to relieve the pressure. She died during post-operative care. That makes me extra sad. I've had severe vertigo and was at a point I'd try anything to make it stop. Could have been me easily. I remember a guy who came to the ER for a painful ear infection and his ear was a real mess. When I asked him what exactly he had done to treat it, he told me that first he stuck some minced garlic, then he poured alcohol into it, and then he shoved a cigarette, which, obviously, didn't get very far but still managed to burn him quite a bit. Patient came into the ED for basically necrotic toes. She said she tried soaking it in bleach a few times a day and it just kept getting worse. Used to work in urgent care. A woman burned her thumb while cooking, and to treat it she wrapped numerous rubber bands around her thumb and left them in place for a week under some gauze wrapping, effectively putting a tourniquet on her thumb. By the time she came into my urgent care, complaining of pain spreading to her hand, her thumb was practically black and falling off when we removed the bandage. Thumbs down. Former EMT and not a doctor, but one time had a patient who decided to cool her fever by dousing herself in rubbing alcohol. She then decided she needed a cigarette. We got to take her to the hospital for burns after her clothes caught on fire. Dousing? I think dosing yourself with rubbing alcohol would kill you without any fire. We had a patient in our UC who was having lower back pain, so he put ice on it. He said it felt so good and he hadn't slept in a few days due to the pain, and he fell asleep with the ice pack on his bare skin. He woke up with the ice pack stuck to his skin and came into the office. He had second-degree burns and the blistered skin was peeled cut off with the ice pack. That's why my mother would always tell me to wrap ice pack in a towel. Dentist here. Patient had a ceramic crown fall off their tooth. Instead of coming in to see me to resmont it, which is very easy to do, they used super glue themselves. Don't do that, please. The body does not like super glue. I'm a genetic counselor and not a doctor, but was meeting with a patient about genetic testing related to her triple negative breast cancer, often an aggressive form and more likely to be due to mutation in the BRCA1 gene. She had brought a friend along to the appointment. As I remember, the appointment generally was pretty normal. At the end I'm filling out some paperwork. Patient goes to the restroom and friend stays in the room chatting. Suddenly she says, "I'm just so proud of her for how she's handling all of this. She did all of this research and found online a way to treat her cancer with vitamins and herbs. It's been so good for her. It took everything in me not to tell her off. But hey, I'm not a doctor and it's not my place, plus wouldn't have done any good anyway." When the patient came back I said something about please talk to your doctor about all medications and treatments you're pursuing. This type of cancer is not something to mess around with, but I can't say much more because I'm not a doctor and not an oncologist. Spoiler alert, she didn't talk to her doctor about any of it. Had a patient doing urine therapy, which involved putting her own urine in her eyes. Came into the ER with severe conjunctivitis. I don't often have to consult ophthalmology, but I was genuinely concerned she'd permanently lose her vision. Your body gets rid of urine for a reason, people. Leave it out of your body where it belongs. My uncle is immunocompromised, and at the beginning of the COVID pandemic he was scrubbing his eyeballs with soap because he heard the virus A gets in your eyes and B is killed by soap. I managed to convince him that soap also kills some other pretty important stuff in your eye, and that he should at least ask his doctor if that's a good idea first. Not my story, but a teacher from high school. She was teaching an elective health class. She used to be a nurse. Told us how a woman had her daughter sit in a kiddie pool filled with bleach because she had an STD. The poor girl had some serious chemical burns. I had a patient in clinic with a large breast mass. We asked how long ago she noticed it. She'd known it was there for about a year but was using anointed olive oil and prayers as treatment. The cancer was advanced by the time she came in. New. I have breast cancer. Stage 4. It sucks. The treatment sucks. But somehow, that is worse. I think it's the thought of all the unknown carnage that any metastases could be causing. At least I know where my meds are and what they are doing. bones, and nothing for now. Anesthesiologist here. A guy said he ate something and didn't feel good, so he tried to induce vomiting. He tried by sticking a fork in his mouth but lost control of it and he swallowed it with the tines pointing up. The OR team was called in to try to pull a foreign body out of his esophagus. I saw the x-ray and was dubious since the fork was very far down, close to the stomach, and the tines were pointed up. Frequently a GI doctor can go in with a scope and pull a foreign body up out of the mouth, but this seemed to be a bad situation since the tines would catch on the tissue. Well, we anesthetized him and the GI doc tried and failed. He ended up pushing the fork all the way into the stomach and he called a general surgeon who made an incision on the abdomen and removed the fork. How do you swallow a fork? I'm a physical therapist. A lot of my patients joke about needing WD-40 for their creaky and arthritic joints. Had another patient make this joke a few years ago. I politely laughed. He then leaned in real close and said, but sometimes I really spray some WD-40 on my knee and rub it in and it helps. Placebo is a wonderful thing. Placebo is great so long as the placebo treatment isn't actually harmful. ED nurse here. I once had a patient come in a kinetic crisis. They couldn't move except to talk, and even that was difficult. They were sweaty and really warm as well. What happened was that they had Parkinson's disease, had it for a while by then, but they'd been convinced by a friend to stop taking their meds and visit a Christian faith healer. They were convinced that their Parkinson's had been cured and that their symptoms were caused by their body getting rid of the Parkinson's toxins. One very long conversation with neurology later, we got them started on a couple of medication patches and admitted to the ward. But that was a super depressing presentation. Eye doctor here. Right at the start of COVID, I had a patient come in with blurred vision and I start examining him. Mid-20s guy, whole life ahead of him. I can't get his vision better in any way I try, so I start looking at his eyes and looking at his retinas. Something is severely damaged. He has 2 burn holes in his retinas. Have you been sun gazing apparently? He read somewhere that vitamin D was good for resisting COVID, which you can get from sunlight exposure to the skin to promote natural synthesis. So he thought he would collect as much sunlight as he could with his eyes. He has solar retinopathy now and permanently reduced vision with no chance at improvement after burning holes in his maculas. Edit. Just a reminder, half of all people are below median intelligence. Other eye story. This is from one of my colleagues who had a patient that heard eye massages can help you see better. They don't. So he proceeded to use a percussion massage gun, like a Theragun, and instantly detached both of his retinas. Now will have permanently reduced vision. Once had a patient ask if his clonidine would help in the event he was bitten by a rattlesnake. I don't know if he tried this, but I hope not. Not a doctor, was in a small town of the ones where there's just a bunch of sheet thingies hanging from the ceiling to separate the beds, and the guy in the next bed had tried to remove a tattoo by heating up a spatula and burning it off. I guess it works, but then he have a big scar instead. A nurse, not a doctor, but I had a little girl a while ago who had gotten 2nd-degree burns from some hot water spilling on her. Her family used mustard as burn cream basically all over her torso and arms. Her family didn't bring her to the ER until the next day, so she was covered with blisters, peeling skin, and dried mustard. We had to scrub the dried mustard off before we could even really see what was going on with her burns. Very sad case. My goodness, that poor little girl. I'm not a doctor, just a medic. At the start of the pandemic I was working in the ER. Patient comes in with arrhythmia and other issues along with being COVID positive. His home remedy was to huff Chinese herbs because it was a Chinese virus. We all were in disbelief back then that someone would try that. Outstanding move. They likely heard from their grandfather that eating paella was effective for the Spanish flu. Eating live slugs for stomach ulcers. This was somewhat a grandmother's recipe in his village. Poor man came to the ER with severe upper gastrointestinal bleeding and received proper medication. Pediatric dental assistant here. One mother refused to have her children's teeth treated with anything other than clove essential oil. Clove oil can be used to soothe pain temporarily, and is even an ingredient in a common oral medicine. But it couldn't cure the many cavities her kids had. I only worked with one of her kids, she had 4. I believe, but I remember that over 25% of that child's teeth needed either fillings or crowns. 1 was severely abscessed, and 2 were beyond treatment and needed extraction. The smell was not great. She refused the recommended treatment, so we had her sign a paper stating that we explained the necessary treatment, why we felt it was essential, and she was refusing it against medical advice. Then we dismissed her from the practice. I still think about those kids sometimes and I hope they're okay. Narrator, they weren't. We had a lady who got poison ivy on her calf and shin. Simple enough to treat, right? Well, she decided to dry it out by dipping and soaking her leg in bleach. We amputated. Kinda the opposite. I had jock itch that wouldn't go away, and anything I tried would subside it and it would come back later. I talked to my PC and he told me to use a little bleach in water and spray it on myself. I didn't do that and instead saw a specialist, who told me it wasn't jock itch but psoriasis, and would have gotten 10x worse if sprayed with bleach. Well, jock itch being caused by a fungus, then the treatment would have worked if the diagnosis had been correct. But this is why if it's my skin I always see my dermatologist. One of my patients crushed oral antibiotics he had at home and rubbed them into an infection on his leg. It did not work. This is one of the rare ones where I get the thought process. It feels stupid, but I don't know enough about antibiotics to know why that wouldn't be effective. Not a doctor, but I worked in the air. A wife rubbed activated charcoal on her husband's infected legs, stating that she wanted him to have something natural and not toxic like those antibiotics. He later died from sepsis. Lady, bacteria are natural, but they're killing your husband. Here's a light-hearted opposite tale, relayed to me by a nurse and caregiver. We'll start with the actual medicine. The nurse worked in a hospital and took care of elderly patients. One geriatric woman was brought into the facility and had to remain there. The exact condition she had is unknown to me, but it caused her strong pain in limbs and joints. Predictably, painkillers are administered. Let her have a few pills. It doesn't help. The old woman still complains. She's suffering and in pain. The dosage is increased. To no avail. Her wailing does not cease, despite receiving a rather high amount of the good stuff. Examining her behavior, it is noticed that this elder is in fact not in dire pain. Her movements are without the strain she would usually endure. So, trickery is called for. The nurse mixes up an awful concoction of salt, vinegar, some bitter, vaguely medicine-y substance and gives the old woman a hefty spoonful of it. She scrunches up, but takes it. Nurse assures the patient that the worse the medicine, the better its effect. Miraculously, the pain fades within the hour. Wondrous. Dentist here had an older male patient that loved his Cajun water filter and loved his water flosser. He wanted to really kill the bacteria in his mouth, so he used the acidic setting on the filter to create a low pH water he'd run through his water flosser to irrigate between his teeth. Acid and teeth. Within just 3 months he'd gone from relatively healthy teeth for a man his age to having eroded away. Similar to a bulimic, only more extensive. Nearly 50% of the tooth between at least 50% of his teeth. It was nearly non-restorable without a major overhaul, having a questionable prognosis. He refused to believe that could be the case and continued to use the machine even after we advised him not to do so. I don't understand Cajun's claims or even know if the machine can really create an acidic pH water without some other iron involved. I do know that this man claimed no other dietary or drug changes and his teeth were nearly destroyed in just 3 months by the water the filter produced. I worked in a private hospital, which specialized in orthopedic and ophthalmic procedures, as a runner and admin guy for operating theaters. We had a guy who had a knee replacement and let his dog lick the wound, because he believed that dogs have sterile mouths and that their saliva can kill bacteria. His wound was infected right to the bone and he had to have it redone at his expense. Not easy to redo a joint replacement, and at the time it was around £12 14k. Private hospital. I'm sure it's no big deal, but I never want my dog to taste my blood. Other blood sure, but no, I don't want you getting a taste for any of my wounds. Patient with colorectal cancer, convinced by their family to decline medical advice and pursue natural remedies, finally returned about 6 months later. The tumor had eroded through the abdominal wall, perineum and genitals. Not a good way to go. and very sad. Poison control pharmacist here. I've got a million of them. We had a guy doing electrolysis in his bathtub to dissolve silver bars in order to ingest the colloidal silver solution. He was doing this daily for months for some kind of magic health benefit. He presented with now permanent, irreversible argyria, which turned his skin and viscera totally blue in color. He looks like a smurf and we don't have a chelating agent to remove it from his body, like we have for some other heavy metals. A girl in my class had a earache and decided to pour hot olive oil down her ear. Went to the hospital and was off for like 2 months. Surprising. My grams used this as a home remedy before antibiotics were available. It's quite effective, according to her. That said, it should be warm, not hot, and used sparingly. You need very little. Not a doctor, but there was a story here in Argentina about a guy that had a horrible back pain. His solution? Injecting his arm with his own semen. He went like that for about 1 or 2 years, then doctors had to cut some parts of his arm because it was wasted. Inpatient speech language pathologist here. Work with strokes, head and neck cancer, etc. Was consulted to evaluate a patient to see if they were ready to start eating by mouth again. This guy was a self-described puller. He had wide coat anxiety and distrust of MDs and never went to the dentist, so whenever he'd get a toothache, he'd grab pliers and extract the tooth himself. Well, one tooth would not come out. Eventually family convinces him to go to hospital BC of swelling and pain. He had oral cancer with such bone invasion that the tooth was locked in. Had to have very intense surgery involving reconstruction of his mouth using part of his fibula and skin from his arm. Unfortunately, hair likes dark moist conditions to grow, so it's not uncommon to see intense hair growth on the skin flap that now forms the floor of the inside of the mouth. Won't ever forget that guy. Till hair can grow inside the mouth. Not a doctor, but work for one. A patient believed she had intestinal parasites and read that drinking paint thinner would help. This made the lining of her intestines start to slough off and come out in her excrement. She saw the white stuff in her poop and thought it was proof that she had parasites and this treatment was working. I really cannot overstate how normal this woman seemed before all this. If a co-worker had told me this story and asked me to guess which patient this was, never in a million years would I have guessed it was her. Everyone was shocked, including the therapist on staff who saw her twice monthly. The doctor had to send her a message over the portal begging her to stop because she was killing herself. Patient had a blocked stoma. He's had this before. He knows to flush it with water, but this time he used boiling water. No one had ever treated a scalded colon before. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.